proud of a corporate entity like this stepping up and working with Family Promise to help these homeless families around the country. Thank you, Mr. Speaker. Yield back.
Thank you. The Chair lays before the House the following personal request.
Leave of absence requested for Mrs. Walorski of Indiana for today.
Without objection, the request is granted. Under the Speaker's announced policy of January 3rd, 2013, the gentleman from Nevada, Mr. Horsford, is recognized for 60 minutes as the designee of the Minority Leader.
Good evening, and thank you, Mr. Speaker. We are pleased to come to this body at this time for this hour of power with the Congressional Black Caucus. This evening, we'd like to focus on eliminating health disparities in America. You know, health is a cornerstone of equal opportunity, which is why access to quality, affordable care is so important. Sickness not only decreases individual and social productivity, but without access to health resources, many get sick and never truly recover. Over this next hour, members of the Congressional Black Caucus will discuss our priorities, working together with the President, our colleagues on the other side and throughout this body, and in the other chamber, to address the needs of health care for all Americans, and specifically to eliminate the health disparities in the African American communities. I'd like to recognize the chair of the Congressional Black Caucus. Under her leadership, the CBC is advancing a number of priorities during this 113th Congress. She is the gentlelady from Ohio, Chairwoman Fudge.
Thank you so very much. I thank the gentleman for yielding, and I want to thank my colleagues, both Congressman Horsford and Jeffries, again for leading the Congressional Black Caucus Special Order Hour. This hour is to discuss health disparities. You both have done an incredible job carrying the message of the CBC on the House floor each week, and I thank you. Mr. Speaker, the health disparities between African Americans and other racial and ethnic populations are striking. When compared to the country as a whole, African Americans are 3 times more likely to die from diabetes. We account for about 44% of all new HIV infections among adults and adolescents, despite representing only about 13% of the U.S. population. African American men can expect to live approximately 6 years less than white men. African American women are twice as likely to give birth to low-weight infants, and our children are almost 5 times more likely to be hospitalized for asthma. Though health disparities manifest in life-threatening ways, such as lower life expectancy and higher disease rates, the root cause is poverty. Where you live and how you live have a direct effect on how long and how well you live. Until we address the persistent poverty that plagues our communities, the debilitating cost of health disparities will continue to rise. According to the Joint Center for Political and Economic Studies, health disparities collectively cost minorities more than $1.24 trillion from 2003 to 2006. We must create and maintain a path toward greater health equity in America. We can't afford the status quo. Thankfully, a path to equity has begun to take shape, a path that reduces the rates of illness and premature death and increases access to quality health care. The solution was and is the Affordable Care Act, or as it is known to many, Obamacare. We are proud to call it Obamacare because it proves that the President and many in this Congress really do care about the health of Americans. Obamacare has already begun to lower the cost of health care by providing financial relief for consumers, increasing insurance options, investing in preventative and primary care, and placing a focus on minority health. The ACA helps decrease health disparities by collecting data, strengthening cultural training, and increasing diversity in the healthcare field. These investments are critically important and will strengthen America's financial future. Some on the other side of the aisle believe the status quo is sufficient, that health disparities are not real. Some don't believe that the impact of disparities on families is devastating. That's why a number of Republicans are again calling for the repeal of the ACA. How many times do we have to play this game? The CBC will continue to stand up, speak out, and defend the Affordable Care Act against all of those who oppose it for political or ideological reasons. Attaining health equity is to the benefit of all Americans, and is not only consistent with the American promise of opportunity, but it is critical to the future of Black America. I thank you, and I yield back.
Thank you. At this time, I'd like to recognize the Vice Chairman of the Congressional Black Caucus, a leader on a number of key issues that the Congressional Black Caucus is facing this 113th Congress, the gentleman from North Carolina, Mr. Butterfield.
Let me thank you, Mr. Horsford, for yielding time this evening, and thank you for your leadership, not only here in the Congress, but in the Congressional Black Caucus. You have come to this Congress and you have done so much in such a short period of time. Thank you, Mr. Jeffries and Ms. Fudge as well, for your leadership. But, Mr. Speaker, I want to start this conversation this evening by talking about a 1985 report. President Ronald Reagan was president at the time, and the U.S. Department of Health and Human Services issued a statement. They called health disparities in the United States of America an affront both to our ideals and to the ongoing genius of American medicine. It's disgusting, Mr. Speaker, that in this year, 2013, health disparities still exist in the richest and most powerful country in the world. African Americans are disproportionately less healthy. Life-threatening diseases like high blood pressure and diabetes and heart disease are ravaging our population. Oftentimes, African Americans that live in rural communities like the one that I represent in North Carolina don't have insurance, and they have difficulty finding a regular primary care doctor, and so they go without an annual physical or regular checkups. Sometimes their only interaction with a health care provider is when they call 911 because their unchecked blood pressure resulted in a heart attack or stroke. By then, it's too late. If that same person, Mr. Speaker, suffering from a stroke would have access to care, their high blood pressure may have been diagnosed early. They may have been put on medication meant to regulate their condition, making a heart attack or stroke less likely. Many African Americans do play an active role in their health care, but the quality of the care they receive can be much worse than their white counterparts, further widening the gulf of disparities. A significant driver of these disparities is the lack of health insurance, and that's what the gentlelady spoke about a moment ago. African Americans make up 13% of the entire population, but account for more than 50% of all people who are uninsured. African Americans are also likely to have disproportionately lower access to primary care and often receive poorer quality care and face more barriers in seeking treatment for chronic disease management. The Affordable Care Act that we are all so proud of was designed to put a premium on quality of care, increased access, and encourage and reward good health care outcomes. I am a strong supporter of the Affordable Care Act, and my constituents in North Carolina are as well. Every person should have access to affordable quality health care, regardless of who they are, where they come from, and how much money they have in their bank accounts. Before the Affordable Care Act was signed into law, 50 million people lived without health insurance. An additional 38 million people had insurance, but it was woefully inadequate and charged them exorbitant co-insurance payments and huge co-pays and completely unmanageable out-of-pocket expenses, essentially making them uninsured too. That means nearly one-third of all Americans were without the very basic insurance needed to see a health care professional and receive care at an affordable price. When President Barack Obama proposed and congressional Democrats introduced the Affordable Care Act, Republicans stirred up for a battle. They would scream in the town hall meetings all across the country, and even right here on this House floor, about how the bill would create death panels who would decide if a person was worthy of receiving treatment for a particular disease. That was not correct. They would insist that the bill would gut hundreds of millions of dollars from Medicare. Not correct. In fact, the Affordable Care Act specifically prohibits cuts to the guaranteed Medicare benefits. They would bring out charts on this floor and graphs that showed how the Affordable Care Act would be a job killer, worse than we have ever experienced before. That turned out to be a lie. The cost of health care has risen each year. Insurance coverage has decreased each year, and the amount of uncompensated care has increased every year. Mr. Horsford, here's a statistic that really stands out with me. In 1970, the United States spent $75 billion on health care. That was 7.2% of GDP. In 2010, health care spending represented 17.9% of GDP, and if not for the Affordable Care Act, was expected to reach 20% by the year 2020. The U.S. spends more of its dollars for health care-related expenses than any other country in the world, and the uncontrolled rise in the cost of health care would have been completely unsustainable if not for Obamacare. President Obama signed the Affordable Care Act into law, and with the stroke of a pen, revolutionized health care in America. Insurance companies can no longer deny coverage to people with pre-existing conditions or charge them more than anyone else. There's now no lifetime dollar limit on what insurers will pay for claims. Preventative visits to health care providers are now free. Yes, free. And even include some free vaccinations. Young adults can now stay on their parents' policy until they are 26 years old. And all new group health plans now have to cover all recommendations by the U.S. Preventive Services Task Force. Now, millions of people in our country and in my congressional district, and Mr. Horsford, in your congressional district, who were living without the most basic health insurance can benefit from the most advanced health care technology in the world. My only disappointment, Mr. Speaker, is that some of our Republican governors and state legislatures across the country are refusing to participate in the expansion of Medicaid. Shame on them. Mr. Speaker, in closing, I am confident that because of the Affordable Care Act, the delta of health disparities in America will begin to shrink. No matter the color of your skin or the amount of money you have, each and every American deserves high-quality health care so they can live long and prosperous lives. Mr. Horsford, I thank you so very much for yielding time. At this time, I will yield back my time.
Thank you, Mr. Vice Chairman, and thank you for your leadership and commitment on these issues, and I know we will continue to fight and advocate for the preservation of the Affordable Care Act, and as you indicate, the proper implementation of that act with the expansion of Medicaid and the other key provisions of the law, which we need our local and state partners to work with us in providing quality health care for all Americans. Mr. Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks on the subject of this special order.
Without objection.
Thank you. And I also would like to submit a statement by the Honorable Eddie Bernice Johnson for the record.
The statement will be included.
Thank you. At this time, I'd like to recognize the chair of the Congressional Black Caucus's Health Brain Trust, the gentle lady from Virgin Islands, the doctor in the House, the person who knows more about health care than most, the Honorable gentle lady from the Virgin Islands, Ms. Christensen.
Thank you, Mr. Horsford, and thank you and our other colleagues, Mr. Jeffries, for hosting these special orders every week. It's been with great pride that we've watched our young new members come to the floor and present the case so forcefully and so effectively to the American people on the disparities in all areas that African Americans and other people of color and the poor are facing. Before I start, I want to also ask unanimous consent for Barbara Lee to enter a statement in the record. She could not be with us this evening, but her work in HIV and AIDS and other areas in health care, but specifically in HIV and AIDS, both here in the United States and across the globe, is worthy of recognition, and I know that she'll be entering a statement for the record on some of the issues around HIV and AIDS. I want to just go back a little bit and present a little bit of historical context on just how long this battle to eliminate health disparities has been going on. I'm going to go back, of course it goes back to slavery, but I want to go back to W.E.B. Du Bois in 1899 when he said, and I'm quoting, "There have been few other cases in the history of civilized peoples where human suffering has been viewed with such peculiar indifference." And then 25 or so years later, and this was mentioned by Congressman Butterfield, in 1985, the Heckler Report, where it was said, and I'm quoting here, "There was a continuing disparity in the burden of death and illness experienced by blacks and other minority Americans as compared with our nation's population as a whole." And as he said, the stubborn disparity remained. The stubborn disparity remained an affront to both our ideals and the genius of American medicine. And Surgeon General Heckler was very surprised by what that report found. But when she asked her researchers, well, why is this? The only answer that they could give her was, it's always been that way. And so that stubborn indifference that W.E.B. Du Bois mentioned in 1899 continued into as far 25 years later. Almost 20 years later, the IOM issued its unequal treatment report, which said in unassailable terms, found that even when insurance and income are as the same as those of whites, minorities often receive fewer tests, less sophisticated treatment for a panoply of ailments, including heart disease, cancer, diabetes, and HIV/AIDS. So even when you have insurance, even when your educational level, even when your income is the same, you are still not getting the same treatment. And so it's no wonder that African Americans and other people of color have suffered from disparities for so long. So in 2003, led then by Jesse Jackson Jr., we insisted that there be a report every year on health disparities, a national report. And the very last one, so we're in our 11th year now, well, we're in our 10th year now, and the very last report shows very little change. It showed that blacks receive worse care, this talks about quality, than whites for 41% of quality measures. Hispanics receive worse care than non-Hispanic whites for 39% of measures. Asians and American Indians and Alaskan Natives receive worse care than whites for nearly 30% of quality measures. And in terms of access, blacks had worse access to care for 32% of access measures, Asians for 17%, and American Indians and Alaskan Natives for 62%, and Hispanics 63% of the measures. So as we look over the years from 1899 to 2011, which is what this report is on, there has been very, very little change. And among the themes that emerged from the report, healthcare quality and access are suboptimal, especially for racial and ethnic minorities. This is in 2011. And I'm sure the report this year is not going to be any different. Quality is improving, but disparities are not improving. There are several areas where disparities are worsening over time between minorities and whites, and those are maternal deaths in the black population, breast cancer diagnosed at an advanced age for women in the black population, children 0 to 40 pounds their families are not getting advice in the Asian population about seatbelts. Adults over 50 not receiving colonoscopy, sigmoidoscopy, or anything in the American Indian and Native and Alaskan Native population. And, and so when looking at these reports coming back the same way year after year, the Tri-Caucus, the Black, Hispanic, and Asian Caucus, when we began to debate the Affordable Care Act and to write the Affordable Care Act, we came together and said health equity had to be a core goal of healthcare reform. And we were able to insert into the bill many of the provisions that we had worked on for many years to create health equity and to begin to eliminate health disparities. And so we call on all of people across the country to support us and make sure that all of those attempts to repeal the Affordable Care Act, which would close the door that we have been able to open for so many who have not had access to quality health care for so long, would not be closed again. And so with that, I'm going to yield back the balance of my time.
Thank you again to the gentlelady from the Virgin Islands and the chair of the Congressional Black Caucus's Health Brain Trust on laying out again the hard work that the Congressional Black Caucus has been involved with for many years in getting to the point with the Affordable Care Act now on the cusp of being fully implemented in January of 2014. And so when our colleagues on the other side spend time bringing up legislation to repeal the Affordable Care Act now for more than 30 times, after this legislation has been approved by Congress, it's been upheld by the courts, it's been signed by the President, and the American people are desperate for quality health care. And that is why we are coming here today to say enough is enough. 30 times to repeal Affordable Care Act. How many more times will we waste the people's house and our time bringing these issues forward when we need to be working together to implement the Affordable Care Act in the way that it's intended? At this time, I'd like to yield to the second vice chair for the Congressional Black Caucus. She's a strong leader for her constituents from New York, the gentlelady from New York, Ms. Clark.
Thank you very much, Congressman Horsford, and I thank you for your leadership along with Congressman Jeffries in leading the special order hour for the Congressional Black Caucus. Mr. Speaker, I rise today to join my colleagues in the Congressional Black Caucus in raising awareness about health disparities that continue to affect racial and ethnic minorities in the United States of America. Despite medical advances that save many lives in our country, there has been very limited progress in ending the racial and ethnic disparities in health. In a 1985 report, the United States Department of Health and Human Services called health disparities in this country, quote, an affront both to our ideals and to our ongoing genius of American medicine, end quote. Now, decades later, health disparities still exist between black and white, rich and poor. A primary reason for these disparities is, quite frankly, the lack of health insurance that has been a problem for all these many years. For instance, African Americans make up 13% of the entire population, but account for more than half of all people who are uninsured. Blacks also have disproportionately lower access to primary care and face more obstacles in seeking treatment. Across our nation, health disparities continue to persist and widen in communities historically marginalized as a result of poverty and other social, economic, and environmental barriers. These communities are experiencing a high burden of life-threatening diseases and poor health outcomes. Population-based approaches, such as recent efforts to reduce childhood obesity rates while showing evidence of success, have been primarily focused on white children in affluent communities. For example, in a report released in 2012 by the CDC, New York showed an overall decline as much as 10% in obesity rates for kindergartners. However, for poor black children, the decline was only 1.9%. And for Hispanic children, it was 3.4%. In my district in Brooklyn, New York, I represent a very large number of immigrants. Close to 40% of the residents are first and second generation Americans. Culturally significant and linguistically tailored education is required to address health disparities. This education is one of the building blocks upon which improvements in early detection and screening in these communities have been built. Health disparities are a serious matter. According to the National Urban League State of Urban Health report in 2009, health disparities cost the United States economy $82.2 billion. I firmly believe in prevention and addressing health disparities, and that it will go a long way in bringing these costs down. It is important that we fully engage in a full implementation of the Affordable Care Act. This will lead us to closing these disparities, this health disparity gap. I look forward to working with my colleagues in the Congressional Black Caucus and, quite frankly, all members of Goodwill to find solid solutions to addressing health disparities in communities of color across this nation. Having said that, Mr. Speaker, I thank you for the time to my colleagues. Mr. Horsford, I yield back the balance of my time.
Thank you to the gentlelady from New York, and appreciate again all of her hard work and her commitment on these issues and her willingness to, again, reach across the aisle, as you said. We're here to work with anybody who wants to work with us to find solutions to the health care crisis that exists in America. But we need them to understand that voting to repeal the Affordable Care Act is not that solution. And there are many more things that we can do together to provide access to health care than we can by repealing this very important legislation. At this time, I'd like to recognize, Mr. Speaker, the gentleman from Illinois, Mr. Davis.
Thank you very much. And, Mr. Speaker, I want to first of all commend our colleagues for coming here every week, raising issues and promoting awareness. Tonight it's health care disparities. You know, I believe that the big problem with the eradication of disparities is the fact that we as a nation have not committed ourselves to the concept that health care ought to be a right and not a privilege. As the most technologically proficient nation on the face of the earth, as the wealthiest nation with a quality of life for large numbers of people that is commendable, we still have not reached the point where we take the position that every person, no matter what their status or circumstance, deserve the highest quality of health care that our nation can afford for them. And so until we reach that point, we will continue to have studies and reports, and we will continue to look at disparities, and we'll keep doing it and doing it and doing it and doing it again. We will have legislation like the Affordable Care Act that is designed to close some of the gaps, and it does in fact close some of the gaps. And it's commendable that we have done that. But I maintain that we have a health care system that really is a sickness care system. And we do a good job of treating illnesses and sickness when people can get to the places where they get the treatment. You know, I had a call yesterday from a person who suggested that they had gone to the emergency room of a hospital and were given 2 Tylenol and sat in a room for a good period of time. And then when they inquired of the hospital why they had done that, they told them, well, it's because of the Obamacare. That Obamacare is causing this to happen to you. Now, the person actually has been on Social Security disability for a long time, before there was any Obamacare and there was a way to pay for their health care. And somebody took the opportunity to misrepresent Obamacare. And I would hope that people would not, especially people in the industry, people in the business, would not do that. But I also urge individual citizens to take more responsibility for our health. You know, there's still disparities in smoking. still disparities in drinking too much alcohol, still disparities in not having the appropriate diet or the exercise that is needed. And so we've got to attack on several fronts. We never put enough resource into the systems to make sure that they work properly and appropriately. We need to put more money into health education, health promotion, health awareness, so that individual citizens have a greater understanding of what it is that they individually can do. Of course, people who know me know that I promote community health centers as the best way of providing ambulatory health care to large numbers of low-income people more effectively than anything else that we've come up with the exception of Medicare and Medicaid in a long time. I still promote these institutions as being one of the best ways in local communities of having health care delivery where people themselves are involved. These centers provide jobs and work opportunities and help keep the money in the neighborhood so that the impact of poverty is not as great as it would be. So, Mr. Horfitz, again, I want to thank you. I want to thank Mr. Jeffries, and I want to commend the caucus for raising the issues, promoting awareness, and helping, hopefully, to develop a different level of understanding. Health care ought to be a right and not a privilege. And I yield back the balance of my time.
I'd like to thank the gentleman from Illinois, and again, just to highlight, as you indicated, the community health centers as an important provision of support within the healthcare delivery system. Both rural and urban communities suffer from the disproportionate distribution of healthcare resources and access to care, and community health care centers play an important component in overcoming that care, providing millions of health care services, particularly to people of color, access to high quality and affordable care in both rural and urban areas. I know in my own district, in Nevada's 4th District, we have 14 health centers throughout our region, and from my rural parts to the urban part, these are very important areas. But unfortunately, under the sequester, Mr. Speaker, these are still areas that are under attack because cuts to these health care centers are still being imposed because of the uncertainty of the sequester. In my district, the Nevada Health Centers, they're looking at over $700,000 worth of reduction between now and September, elimination of nursing positions, an elimination of services for children and seniors at a time when people are sick and they need it the most. So I would hope that, again, we can work together with members on the other side to come up with solutions to replace the sequester and to fully fund community health centers who are providing such good care to our citizens at this time. I would like to turn now, Mr. Speaker, and recognize the gentlelady from Texas, Congresswoman Sheila Jackson Lee.
Thank you very much. Let me thank the conveners of this special order and express my appreciation to Mr. Horsford and to Mr. Jeffries for continuing to educate our colleagues on extremely important issues. And I'm delighted to join the Congressional Black Caucus as it proceeds continuously to ensure that we advocate for those who cannot speak for themselves. I want to take up an issue that has struck home and is being confronted by many states, some of whom are in the South, and some are in other places throughout the nation. I was very pleased to stand with my fellow Democrats and support the Affordable Care Act. I could go through the journey of 2009 and 2010 when many of us spread out across the country and confronted misinformation through town hall meetings, controversy, and conflictedness. And I think that what should be continuously emphasized is the President's leadership on one single point, that although health care was not listed per se in the Constitution, it should be a constitutional right. And if you read the words or quote the words of the Declaration of Independence, we hold these truths to be self-evident, that we have certain inalienable rights of life, liberty, and the pursuit of happiness. One might argue that education and health care fall into those provisions of life, liberty, and the pursuit of happiness. It was in the context of that framework and the original words of the Constitution that as you open the book that has the provisions of the Constitution, the opening phraseology indicates that we've come together to create a more perfect union. I think the Affordable Care Act was intended to try and lift the boats of all people. And interestingly enough, major hospitals across America were clamoring for the passage of this legislation to really do what we are speaking about, which is to cut into the health disparities, because our hospitals across America were suffering from not being reimbursed on uncompensated care for those people who came without insurance. Many of them included African Americans who suffered in larger numbers from the difficulties with diabetes, for example. And Texas, which is now in the eye of the storm, is one of those states that has rejected the expansion of Medicaid, which goes to the very point of increasing opportunities for those who suffer disparities so that they can have access to health care. And that is largely the problem here in Texas. Federal funding for adult expansion far exceeds current local expenses for unreimbursed health care costs. Having 3 years without any match whatsoever, and then having the ability to have a very small match later on. It is estimated that Medicaid expansion would generate more than 231,000 jobs in 2016, 1.8 percentage point reduction in the state's current unemployment from 6.1% to 4.3%. And it would directly address the disparities in diabetes, heart disease, and HIV/AIDS. In partnership with our federally qualified health clinics, which many states have seen expanded because of the Affordable Care Act, and now in my own home state, in my city in particular, Central Care has now put more community health clinics in areas where disparities were severe and lives were being lost. It benefits children as well. And I'd like to cite some numbers here for my colleagues to indicate what we would benefit from by the expansion of Medicare. Unreimbursed health care costs for charity care in 2010 for an estimated $4.4 billion is in unreimbursed expenses. We would be covering that. We'd also get off the #1 list. Texas, #1, ranking among states with the greatest share of uninsured residents at 23.8% in 2011, more than 6 million people compared with the national average of 15.7%. And then, as I indicated, we would, again, eliminate the opportunity for low-income adults to be able to secure care. When low-income adults don't get care, their children don't get care. And so I am suggesting that the rejection by Governor Perry, along with other governors, to not accept the expanded Medicaid has a direct impact on the increase not only of the uninsured, but the increase in the numbers of those suffering from certain diseases who cannot get care, and therefore, rather than have preventative care, which an expansion of Medicaid would provide, allowing for doctor visits, then the only time that we are able to secure health care for them is when they arrive in the cities and the counties and the states' emergency rooms, where we see a surge in emergency room costs health care costs, and we eliminate the goodwill and the good intentions of a very good bill that answers the question, are we attempting to form a more perfect union by establishing a framework of insurance for all Americans, hard-working Americans, Americans that are of Asian descent and African descent and Hispanic descent who have different DNA and cultural indices that would lead them to have certain diseases more than others. Let me also take note of the fact that one of those particular diseases that impact the African-American woman in more a devastating manner than in others, and that is triple-negative breast cancer, that impacts Hispanic women and African-American women and Anglo women, but more so in the African-American community. That kind of diagnosis gives, in this current phase of time, a short and almost devastating diagnosis, one that is difficult to recover from, one that sees an increase in the loss of life. So I would make the argument to Governor Perry and to governors across the nation who have rejected the expanded Medicaid as a budget issue, as a political issue, as a I'm going to stand up to the president issue. You are wrong. You're absolutely wrong. Because this is not a political issue. This is a life and death question. And I want to applaud governors like those in Florida who certainly, obviously, may not welcome the applause. But I think it's important when people stand on principle or what is good for others that they should be applauded. So I applaud the governor of Ohio and the governor of Florida for moving forward on Medicaid expansion. And I would say to my good friend who is leading this very important special order that we need to begin to work with the President to find ways to substitute the rejection of the Medicaid expansion so that individuals that are in these states who cannot speak for themselves, who in actuality have a head of state, a governor, that is making a political decision, a simple political decision, will not lose out on the benefits intended by the Affordable Care Act, which is to give comfort and to give help and aid to those who need health care. I finish on this note. I want to thank Dr. Christensen because when we began to write this legislation, it was the Congressional Black Caucus that one talked about the health care disparities, which were the premise of the fact of expanding health care, and it would be a shame if after all this work and passage of this bill, there'd be innocent persons in our respective states, like Texas, that could not benefit from something that could save lives. I thank the gentleman for yielding, and I yield back to the gentleman.
Thank you very much to the gentlelady from Texas, and we know we stand with you, your colleagues, here on the floor to continue to put pressure on leaders not only in Texas but throughout the country who do not see the value of expanding Medicaid. I'm fortunate in Nevada. We have a Republican governor, but he has agreed to provide the expansion for Medicaid because he understands that in Nevada, a third of our population is currently uninsured, and with the expansion of Medicaid, that's going to make sure that fewer people turn up in the emergency rooms through uncompensated care, which all of us as taxpayers end up paying for. So this is an issue where Republicans who understand the bottom line in terms of health care and cost can work together with us to implement good policy for the American people. So we'll continue to work with governors that have not seen the light, but we believe that this is a plan that will work very effectively. Mr. Speaker, can I ask how much time we have remaining?
The gentleman has 18 minutes.
Thank you, Mr. Speaker. At this time, I'd like to turn to several of our new members of the 113th Congress. I'm very pleased and honored to be serving with them. I've learned so much from all the members here, but particularly have enjoyed getting to know the new members of the Congressional Black Caucus. There's 5 new members, and I'd like to recognize the gentleman from New Jersey, the man with a great legacy who's carrying on the legacy of the late Congressman Payne. But I'd like to recognize my good friend, the gentleman from New Jersey, Representative Payne, Jr., at this time.
Thank you, Mr. Speaker. Let me first thank my colleagues, Congressman Horsford from Nevada and Congressman Jeffries of New York for anchoring tonight's CBC special order on eliminating health disparities. I'd also be remiss if I did not acknowledge our leader on health issues in the Congressional Black Caucus, Dr. Christensen. And Mr. Speaker, I'd also like to take the opportunity to acknowledge a young person on the floor, the gentlelady from Utah, potentially the next Nevada, I'm sorry, my goodness, from Nevada, the young Miss Horsford, who is here tonight. This is truly unique quality time to spend with your daughter. There are numerous factors that contribute to the growing health disparities in New Jersey's 10th District. Poverty, environmental threats, inadequate access to health care, and educational inadequacies. These issues are so interconnected that a piecemeal approach to fixing them just will not work. A comprehensive approach that focuses on providing access to quality care for all, creating good jobs that provide a decent living, and increasing educational opportunities for low-income communities is the only way to eliminate health disparities once and for all. Even in the 21st century, health disparities are stark, especially in the African American community, in which life expectancies are lower and infant mortality rates are higher. Children of color who live at or below the poverty line are much more likely to have asthma, develop ADHD, contract diseases because they cannot afford vaccinations. So we have a moral obligation to eliminate health disparities. Our children and our future generations are depending on us. But narrowing health disparities that exist is not only good for our nation's health, it's good for our nation's pocketbook. Research tells us that access to quality health care could eliminate or reduce the onset of many chronic illnesses that disproportionate health outcomes and add to the astronomical health care costs every year. Yet many of my colleagues won't rest until they repeal Obamacare. The fact is, the Affordable Care Act will now provide health care to 9 million African Americans who are uninsured or underinsured. Obamacare ensures that everyone has access to life-saving care, such as preventative cancer screenings, as well as coverage for children with pre-existing conditions. We know that Obamacare's preventative services will help save lives and save money. So why are my Republican colleagues so set on repealing it? We have to protect Obamacare, just like we have to protect Medicare and Medicaid. And sequestration is a direct attack on these already limited health resources. Sequestration is an irresponsible, across-the-board cut approach that will only contribute to the widening health disparity gap. Because of sequestration, Medicare has been cut by $11 billion. Cancer patients are being turned away from clinics and cannot get access to life-saving treatment that they need to live. Millions in funding has been cut from community health centers. Furthermore, the effects are very real for the people in New Jersey. In my state, nearly 4,000 fewer children will receive vaccines for diseases such as measles, mumps, rubella, tetanus, whooping cough, influenza, and hepatitis B. Millions in cuts to grants that would help prevent and treat substance abuse. New Jersey will lose nearly $4.9 million in environmental funding that ensures clean air and clean water. We live in a first world country, and you want me to go back home and tell my constituents that we cannot provide them clean water and clean air? This is absolute insanity. And to make matters worse, the New Jersey State Department of Health and Senior Services will be forced to provide 19,000 fewer HIV tests to low-income communities. As a result, sequestration is directly contributing to the spread of this fatal disease, and in essence is providing a death sentence to those who are poor and can't afford the testing. So I say to my colleagues tonight, addressing health disparities is in both this country's moral obligation and a financial imperative. If we are going to truly eliminate disparities, we must start by eliminating sequestration, which does nothing but further the burden of our distressed citizens. And finally, we must maintain and strengthen our investments in health care, access and resources for the disadvantaged populations that we serve. I just want to say in closing that just as Medicaid and Medicare and Social Security have become common threads and fibers of this great nation, one day Obamacare will be looked at in the same manner. Thank you, and I yield back my time.
Thank you very much to the gentleman from New Jersey. I'd like to now turn to the gentlelady from Ohio. She has come to Congress providing great perspective as a member on the Financial Services Committee, specifically, but also her background in higher education and working on a number of these issues, particularly on the need to create a workforce that's trained and ready, particularly in the healthcare sector. I'd like to recognize the gentlelady from Ohio, Congresswoman Beatty.
Thank you, Mr. Speaker. First, let me join my other colleagues in thanking my freshman class members, Mr. Horsford and Mr. Jeffries, for leading the Congressional Black Caucus's important discussion tonight on eliminating health disparities in America. Tonight, you are hearing a lot of statistics because it is so important for us to let America know that low-income Americans, racial and ethnic minorities, and other underserved populations often have a higher rate of disease, fewer treatment options, and reduced access to health care. So you will hear facts tonight. The facts are that African Americans have the highest rate of high blood pressure of all population groups and tend to develop it earlier in life. African Americans are twice as likely to have diabetes than whites. African Americans are twice as likely to die from stroke than whites. African Americans are more than twice as likely to die from prostate cancer than white men. And African American women younger than 40 years of age are more likely to develop breast cancer than white women. Infants born to black women are 1.5 to 3 times more likely to die to those born to women of other races or ethnicities. African Americans are estimated to be 44% of all new HIV infections, despite representing only 13% of the U.S. population. These disparities are shocking, and the Congressional Black Caucus will not let us ignore them. In 2009, health disparities cost the United States economy $82.2 billion. We have to continue to bring awareness to this issue within our communities to develop strategies to eliminate these disparities in a cost-effective way. On March 23, 2010, President Obama signed the Affordable Care Act, which is a monumental step that helps us address these overwhelming statistics, health disparities within our communities. We now have in place comprehensive health care reform that improves access to affordable care and guarantees that millions of our most at-risk citizens will be finally able to receive care. By improving access to quality health care for all Americans, the Affordable Care Act actually reduces health disparities. We share this information so citizens will know this law invests in prevention and wellness, gives individuals and families more control over their own care, and expands initiatives to increase racial and ethnic diversity in healthcare professionals by strengthening cultural competency training for all health providers and improving communications between providers and patients. As a lifelong healthcare advocate and as a stroke provider and as an African-American woman, I know the importance of protecting access to affordable healthcare coverage for all Americans, particularly those who are most in need. We need to continue to move forward with this legislation and initiatives that eliminates health disparities in America, and I look forward to continuing to work with all my colleagues to improve our healthcare system. In order to have a successful nation, we must have a healthy nation. So this is my clarion call to all my colleagues, Democrats and Republicans, to help us make progress on this critical issue. Thank you, and I yield back.
Thank the gentlelady from Ohio. At this time, I'd like to turn to the gentleman from Texas, Congressman Vesey, and would like to thank him again for his hard work and contributions to this new 113th Congress.
Thank you. Would also like to thank the gentleman from the Sagebrush State, Stephen Horsford, and from the Empire State, Hakeem Jeffries, for all of their work on this very important issue, and also talking about the importance of the Affordable Health Care Act and everything that it's going to bring to our country. And I want to talk about reserving this time to also talk about the health care crisis that is ongoing in America today. Unfortunately, obesity and the long-term effects associated with this condition are all too prevalent in our country. When you look at the health statistics, it's quite astounding, to say the least. Today in America, nearly 2/3 of adults and 1 in 3 children are overweight. In my own home state of Texas, we have one of the highest obesity rates in the country, according to the Center for Disease Control and Prevention. 30% or more of Texans are obese. The high obesity rate has contributed to the pervasiveness of diabetes, heart disease, and other chronic diseases that drain resources from our healthcare system. Increases in food intake, lack of physical activity, and environments that make nutritious choices more difficult have all played a role in this obesity epidemic. Many children and adults do not have much control over the choices of foods they are able to get to. Across this country, we're laden with food deserts or places where residents may not be able to get a nutritious food option because they do not own a car or have access to public transportation, or maybe they don't live along walkable roads. This forces families to outsource their daily eating to more accessible and sometimes cheaper alternatives such as fast foods to get their daily nutrients. A steady diet with high fat, salt and sugar-based products have led to unhealthy lifestyles. Diabetes is one of the more commonly known effects of being overweight or obese. The disease affects 25.8 million Americans, roughly 8% of our population. The effects and complications of diabetes can include stroke, high blood pressure, blindness, kidney disease, and amputations. Studies have shown that people with pre-diabetes who lose weight or increase their physical activity can prevent or delay type 2 diabetes, in some cases even return their blood glucose levels to normal. Each of these statistics are just greatly even more exacerbated when you look specifically at the minority population in our country, such as Latinos and African Americans and our special needs population. When you break down obesity by race, African Americans have the highest rates of obesity at roughly over 35%, Latinos a little over 28%, compared to the non-Hispanic white population of 23.7%. Individuals with disabilities also have higher rates of obesity at 31.2%. That is why I introduced House Resolution 195 designating May as Health and Fitness Month. We need to correct our course as a country and get on a path to healthier lifestyles. The numbers are clear. We cannot sustain this unhealthy path we are on. Not only is it cutting the lives of too many Americans short, but it's also costing our country. In 2008, medical costs associated with diabetes were estimated to be at $147 billion. The medical costs for people who are obese were over $1,400 higher than those of normal weight. We need to show our children that we can make healthy, nutritious choices and increase our physical activity. We must also not forget that this must be spread throughout all aspects of our population. While tremendous resources have been employed to help combat the growing obesity epidemic amongst children, markedly fewer have been used to address specific issues regarding how to best help obese children with disabilities. So today, let's declare a more nutritious and healthy lifestyle with better food choices and more active lives. Mr. Horsford, thank you very much.
Thank you, and thank you to the gentleman from Texas. I know we're